is brought to you by Health Plans, your Medicare plans, insurance solutions, and resource agency. We have a variety of plans and products that fit your needs, benefit requirements, and budget, with many low or no-cost premium plans, zero co-pays, and much more. Our licensed benefits advisor's priority is your health and well-being. Call us today and book your no-obligation consultation. 1-929-367-5269.
You are listening to Let's Talk About It with your show host, the celebrity Dr. Cheryl BryantBruce. Hello, everybody. You know me, Dr. Cheryl BryantBruce, MD, the celebrity doc, and I am here with my co-host, Hisham Elamati, Hurricane H, and you are joining us for Chatters That Matters. Let's talk about it. We are here to educate, inform, and entertain you. Our show tonight will be featuring none other than one of my besties, Dr. Dennis Richardson, who is a DO from Pismo Beach Optometry Center, and he will give you more of his background, telling us where he was educated, and he has a nice, rich history. So I am going to just bring him in, and we'll start to talk about it. Welcome, Dr. Dennis Richardson.
Thank you for having me this evening. This is a real honor. My history comes from being born and raised in Los Angeles, California, going to UC Davis. And I think Dr. BryantBruce may be a little familiar with UC Davis.
Go Aggies.
There we go. Go Aggies. I went to school, optometry school in Philadelphia, Pennsylvania at the Pennsylvania College of Optometry. I did an internship in Atlanta, Georgia at Omni Eye Services. And then after that, I went into private practice and actually at one point merged my office with a LASIK surgeon. So I have a lot of background in ocular disease, LASIK, and cataracts. And I relocated from Los Angeles approximately 4.5 years ago to Pismo Beach. And I am the owner and operator of the Pismo Beach Optometric Center right here in Pismo. And so we just take care of everyone in this area, trying to just make sure everybody's, as you say, part of this this presentation, educating people. Education is just really huge. And once people come in and we can educate them, they have a much better understanding of their eye conditions, how to preserve their health, and just what's going on. So once again, it's not just about giving glasses and contact lenses. Education is huge. And so that's why I'm really honored to be here on this show with you. When you told me about what this is all about, I think it's really essential.
Excellent. And the topic of our show today is eye health for eye health. So, and for those of you who don't know, we are featured on EMBC TV network, and one of the places that you can see us is on iHealth TV, and you can hear us on iHealth Radio. So on iHealth, we're talking eye health today. Now, Dr. Richardson, first off, I just want to delineate. Dr. Richardson is a DO. And
it's actually an OD.
OD. Yeah. And that was the reason that I brought that up, because we have DOs who are doctors of osteopathy, and then we have ODs who are the optometrist. So just wanted to clarify that for some people who might have been confused about that and thought, well, gee, I thought those were kind of the guys that manipulate you. No.
We had that. We had that. We did.
But I was like, Oh, that's right. We just had a DO, so let me differentiate those initials so people do understand that there is a difference. So we got bones and we got eyes.
Yeah.
So
Acronyms.
anyway, we want to talk a lot about preventive health, and we want to talk about what you actually can see. Why do people need to get an eye exam on a regular basis with an optometrist? What can you tell us?
Oh, it's just really essential to have an annual exam, no matter whether you're 5 years old or if you're 90 years old. Our range of patients in our office literally is from 5 years old to 101, believe it or not.
Yep.
As the eye, as we mature, things can occur. Over 40, we started getting more incidences of glaucoma. And once again, the glaucoma is definitely more prevalent in the African American and Hispanic populations. So because it's painless, a lot of people don't know they have glaucoma until they get an exam, or unfortunately until they come in and say, well, I need some new glasses because I can't see the TV anymore. And sometimes we just find it's a little bit too late. And so early detection is just of utmost importance. Other things, and Dr. BryantBruce, as you're aware, that diabetes is just rampant. And so diabetes is the number one cause of blindness. And a lot of times someone will come in, and when we have a good look in their eye, we do a dilated exam and take photos and do some other diagnostic testing. We can see the blood vessels leaking blood. And the patient may not have any idea that they have diabetes. Or the other classic thing that we hear is, well, no, I used to have diabetes, but I feel great, so I don't take my medicine anymore. Dr. BryantBruce, you're laughing because you have heard this. Am I correct?
I hear it regularly. And the folks with the blood pressure too. Same thing with the blood pressure.
Exactly. And so, the eye exam just tells so much, and allows us to help patients, because if we see things going on in their eye, then you better believe something else is going on systemically. And so, once again, that's how come, most physicians and endocrinologists, PCPs, they always want to know, what did we see in the back of a patient's eye? And that can help us, as a team better care for the patient and hopefully keep them living. So once again, a lot of the things that we have, that we do, a lot of the eye conditions are painless, so people don't know anything is wrong. And so that's how come an annual eye exam is just really, really, really important.
And it's really important because a lot of times people don't realize that they have high blood pressure, and they don't realize that they have diabetes. And sometimes the first indication is that the patient comes into me and says, well, I saw Dr. Richardson or Dr. whoever else it might be because I thought I needed glasses, but he told me that I needed to see my doctor because I might have high blood pressure or hypertension. Or a really, really bad example, this came from a personal experience. I had a friend that I was dating at the time, and we went in and we got our eye exam together. And the optometrist said, I'm going to need you to see your doctor because there's something going on in your eyes. And so you need to go and get checked. And because he didn't have insurance, he didn't have the money, yada, 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 all the excuses people come up with, he did not go. 2 years later, he was dead because what she saw was a glioblastoma, or a tumor in his brain, pressing on his optic nerve. And the optometrist could see that in his eyes to refer him to the doctor. So if your optometrist says that you have something going on in your eyes, it doesn't matter what it is. If your optometrist says, see your doctor, see your doctor.
Wow, that's a really severe case right there. Oh my
Mhm.
goodness.
Yeah,
Oh my
it
goodness.
was horrible. It was horrible. You know, he went for almost 2 years, complaining that his vision was bad, but he'd lost his glasses, so didn't think too much about it. It's like, have you gone and see your doctor? No, no, no. And then all of a sudden, bam, he was having severe headaches. And when he went in, it was too late. They went in, they opened up, and they closed right back up and said, you have 3 months. And he didn't even make it that far.
Oh
So,
my goodness.
you know,
That's sad.
You know,
yeah,
So
and this was a young man, 50 years old.
oh my goodness.
Yeah.
And so also in addition to like finding systemic things going on like diabetes, hypertension, tumors, um, other things that are of high incidence are age-related macular degeneration. That's
Hmm.
another big one. As the eye
Yeah.
matures, um, our seniors, they tend to get macular degeneration. And before, there wasn't much that could be done for it. Now there is just state-of-the-art technology and treatments to preserve and actually kind of reverse some forms of macular degeneration, especially if it's the wet kind. The wet kind is the one where the blood vessels are leaking, and that really takes your vision. It can take it really fast. So once again, we can see this, we can make the proper referrals, and it can be treated. There's just incredible medications to treat macular degeneration right now.
Now,
Um,
can you tell our audience what macular degeneration is?
well, the macula is the center part of your retina. It's the part of your retina that is responsible for you seeing fine detail and for you seeing central vision. And so once your macula is affected, well, then your visual acuity, like reading on the chart, it diminishes, your central vision diminishes, straight lines become wavy lines, and it can lead to legal blindness if
Hmm.
untreated. So the macula is where everything happens as far as fine detail and acuity. So if
Hmm.
that's affected, then we have a problem. So the main players in the back of the eye are your optic nerve, which goes directly to your brain. And that's how
Hmm.
come we need to screen for glaucoma, because glaucoma will kill your optic nerve left untreated. It will just kill it. And then macular degeneration, the macula, where once again, your visual acuity can be drastically affected. So once again, both of those things, they're painless. And so you don't know you have them. If you don't go in and have somebody take a look, you won't know you have it until one day you're just blind.
Yeah, and these are things that are treatable, right?
They're treatable, absolutely. And so with macular degeneration, once again, the latest drugs, they actually help the blood vessels stop leaking blood, because the blood is what causes all the problems, the swelling in the back of the eye. With glaucoma, the glaucoma treatments these days are absolutely phenomenal. It's constant and continuous research and development in that field. There still is no actual cure for glaucoma, but with treatment, you can slow the process down immensely. So if someone has glaucoma and it's untreated, you could literally go blind as little as 2 to 5 years.
Wow.
With treatment, that can be prolonged and you can stretch out the deterioration for 40 or 50 years.
Hmm.
And every year, there's just a better treatment. And glaucoma comes from having too much pressure building up in the eye, which in turn puts the pressure on your optic nerve and it kills the nerve.
Hmm.
And it's a gradual process. You just don't go blind from glaucoma in a week. It's gradual. And that's come a lot of times the vision loss is gradual and you don't realize it. So the
Right.
new medications, the new treatments, the diagnostic instruments that we have these days to detect glaucoma. And
Hmm.
to be honest with you, when I first started in optometry compared to now, our instrumentation that we have now compared to then, oh my goodness, it's like, how did we even practice without our technology that we have these days. How
You guys have
do we
great
do that?
toys. You have
Oh,
great toys.
oh, yeah, they're great toys. And once again, they're just really great on diagnostics. And without
Mm,
them, it's like, oh my goodness, what was I doing? How were we practicing? Because there
back
was
in the
just so
dark
many.
ages.
Oh my, yeah, and it just constantly gets better. So it's exciting time to be in the eye care field. It's just really
Mhm,
exciting times, and
mhm.
other things not related to disease, and a lot of people are starting to become aware of this now, is the effects of blue light. And Dr.
Mhm.
Brian Bruce, have you heard people talking about blue light?
Yes.
And so, one of the things that we have discovered over the past few years, they did the research. Blue light coming off of our computer screens, coming off of our mobile devices, our iPads, our iPhones. It's proven now that blue light causes damage to the eyes. One of the things that can happen, it can cause early cataract formation. It has a link to macular degeneration, causes dry eye. And this big one that no one knows about, and when I see their face in the exam chair, when I tell them about this last one, they all just, their mouth opens. It, blue light affects your melatonin levels. Dr.
Mhm.
Bryant Bruce, what do we need melatonin for?
We need melatonin to adjust our sleep wake cycles, and it actually stimulates our hormonal cycles. And so it impacts pretty much every aspect of your existence. And it has a huge effect on your metabolism.
It does. And once again, people, they don't realize that melatonin, when you affect your melatonin levels, it affects your sleep. And the number of people that say, well, I look at my cell phone when I'm in bed so I can go to sleep. And then when I tell them this, they're like, is that why I can't sleep? I was like,
Yeah.
yeah, don't look at your phone while you're in the bed. Don't do it. Shut it
Yes.
down.
Well, it is recommended to kind of stay away from any screen at least an hour before and not having a phone or lights in front of you. And by the way, talking about the blue lights, I mean, this happened to me personally.
Mhm.
There was a point when I was literally in front of the screen all the time, and my eyes started hurting. It just like I felt like a burning sensation, and then I purchased the blue light protective glasses, and this like few years already. And since the minute I started using them when I'm on screen, I mean, even right now, my setup, it's blue light protective. So
Mhm.
that helped the difference. And I can feel the difference. Without them, half hour and my eyes start hurting. With them, I don't feel anything. And literally, and it's tested, it works. And, for people out there, it's and I know you guys have those coatings that you put on the glasses, so it works. And I'm not going to say more because you are the doctor and you'll tell our audiences about it, but I am actually a client and it works. I'm a patient here.
Good,
You
good,
just
good.
touched on dry eye. Let's talk about dry eye because that's a big deal. And a lot of people are like, oh, my vision's going bad. I can't see. But the real problem is that they have dry eye. And if the eye is attended to and moisturized, all of a sudden their vision clears up when they put the drops in. So talk to me about dry eye.
Well, dry eye, there's actually a couple of different types of dry eye.
Mhm,
One is related to just not having enough tears. Some people just
mhm.
don't produce tears. Their lacrimal glands just don't produce tears. Some people they don't have tears because a lot of times people are dehydrated. I'm sure Dr. Brian Bruce, you see a whole bunch of dehydration. I know you do.
Yes,
So one
indeed.
type,
Like most of the population.
isn't that something? And so when
Mhm.
we have our dry eye, the type where you don't have much tears, the surface of the eye just dries out and it does affect your vision. Okay. Also, what people don't understand is that with dry eye, when we're looking at our screens like we are right now, our blink rate diminishes. So, Dr. Bryant Bruce, if we're out talking about all this great wine up here in the Central Coast and Hurricane H, how cool he is in Jersey, if we're just sitting down there without our screen talking, you and I, we're going to blink anywhere from 11 to 16 times a minute. Soon as we get in front of our computer screen, our blink rate diminishes down to as little as 1 to 2 times per minute. And this is all documented. Because we don't blink, our tears evaporate into the environment. So if we don't have a bunch of tears, that little bit that we have just evaporates. And that's how come the eye gets really dry. The front surface becomes damaged, and it's a problem. The other type of dry eye is actually due to just having poor tear chemistry. So there's three components of your tears. There's a fat, there's mucus, and there's water. In the proper combinations, everything is great. Your eyes are properly lubricated, your corneas are healthy, you see fantastic, your eyes aren't burning or feeling like there's sand in them. If one of those components is out of whack, then once again, you just have bad tears that don't coat the surface properly. So there's things that we can do. Before, it was just give you a little bottle of artificial tears and say, Dr. BryantBruce, thanks for coming in today. Here are your artificial tears. We'll see you next time. Well, now, because there is so much more, this is once again an area where there's just been extensive research and it's continuous. There's many treatments for dry eye because a lot of it has to do with the actual eyelids and the little glands inside the eyelids called the meibomian glands. They produce a component that's essential for the tear chemistry to be, proper. And so now there's things that we can do.
That's that fatty component, right?
That's the fatty component called the meibum. Absolutely. Mm-hmm. And so once again, there's things that we can do to stimulate the production of the meibum. Sometimes the little glands are just clogged up, and that can just happen as the eye matures. And so there's things that we can do. There's things that we do to stimulate the production. And once again, it's quite extensive. There also are state-of-the-art pharmaceuticals now, eye drops, that are just absolutely fantastic for dry eye. A lot of them are out there, and I'm not going to go into any specific names because I'm not. Right. I don't want to create any type of bias or advertisement. So, but there are some really good. And once again, by going to your optometrist and letting them know what that issue is, it's really important. Also, optometrists working in conjunction with LASIK surgeons and cataract surgeons. It's really important to get good outcomes from cataract surgery or LASIK surgery if the eyes are not dry eyes. If you have dry eyes, then the results are not going to be very well, and the patient will be very disappointed. So dry eye is just huge. That's such a big thing. Thank you for asking about that, because there's just so much more to treating it now than just giving you a little tiny bottle of artificial tear eye drops. Right,
absolutely. Now I'm going to digress onto something that you just talked about, the cataracts, because it made a question pop up in my head. And that question is, because of all of the computer screen time that the younger people are having now, are you seeing cataracts earlier?
Oh my, Dr. BryantBruce. What a question. Yes. And so interesting that you asked that is because before, when we used to see cataracts in 70, 80-year-olds, we're seeing cataracts in 50-year-olds. And we're not talking about 50-something. We're talking about 50. We've had so many patients coming in at age 50 saying that I can't see out of my glasses anymore. And when we actually take a look at their human lens looks like it's an 80-year-old's human lens. And they all have this common denominator. You ask them, well, what do you do for a living? Oh, I'm an engineer. Oh, I'm a website designer. I'm a graphic artist. Something where they're on their computer 8 hours a day. Then they go home and do a little bit more and then look at their mobile device or their laptop. And so because of, once again, the blue light coming off these devices, yes, to answer your question, cataract formation is occurring sooner now because of these of blue light. The big question
Now, you actually see people as young as age 5, and the kids are now, I mean, they come out of the womb with a computer in their hand. Are you seeing cataracts in the children?
At this particular time, we are not, but the great question that you have right there. Well, when this pandemic hit and all these kids were staying at home, everybody was doing school from home, in addition to all the amusement and entertainment. You have posed a really interesting question that in our profession, we have to wait and see. We don't know if a 5-year-old or 6-year-old who was at home during the pandemic, if they're going to have cataracts when they're 15. That is just an incredible question. We do not know. And once again, a child, because they have shorter arms, the device is closer to their face, and the human lens is just so pure and clear. There's nothing to really filter out any type of blue light or ultraviolet radiation. We just have to wait and see what pops up in 10 years.
It'll be interesting to see what happens in 5 to 10 years on health levels across the board, because so much came with that pandemic, the injections, the virus itself. There's a whole lot of, we don't know what we're going to be looking at in 5 and 10 years. And, a whole lot of suspicion that we'll see some morbidity resulting from all of this.
I will bet money on that. It will be sooner than later.
I'm putting my money on it with you, Hurricane.
Yeah.
I think that 5 or 10 years from now is going to be kind of ugly, and we really need to be battening down the hatches to prepare for it and to try and mitigate it as much as possible. And I really like to talk prevention, because there are things we can do from a preventive angle to try and optimize our health. It may not completely keep us from running into the issues that may come, but it may at least mitigate them some so that they're not as bad. So let's talk a little bit of prevention now. What are some of the preventive things that people can do to optimize their visual health?
Well, first of all, when you're outdoors, by all means, please wear sunglasses that have ultraviolet protection. Wear a hat, cap, or visor to catch the rays that are coming down diagonally and from above. Ultraviolet radiation does damage. Number one, it can, once again, cause cataracts. It does have a link to macular degeneration also. It also causes these really ugly things called pterygiums. And pterygiums are growths on the outside of the eye, and it starts to grow across the front of your eye. Sometimes people would kind of look at you and say, what is that thing growing on your eye? It's a pterygium. It's a tissue, and it feeds off of ultraviolet radiation. And we will find pterygiums in pretty much 100% of farmers, 100% of surfers. So anyone who's been out in the sun and around dust, pterygiums are going to grow. So one way to stop them or slow down the process, good sunglasses with ultraviolet protection, hat, cap, or visor. Other prevention, as far as macular degeneration, we always encourage consuming antioxidants. Enjoy some blueberries, some pomegranate. Enjoy your green leafy veggies. Things with omega-3 fatty acids. And,
You're speaking my language.
Yeah, diet has a lot to do with it. It can really help, preserve your eyes. And, those are basic things that we encourage and, once again, try to educate our patients about.
So Dr. Richardson is, like I said, he's speaking my language, and you've heard me time and again say, eat your omegas and shop the rainbow when you go to the store. Those bright colored fruits and veggies have a lot of benefit,
Yes.
across the board for your health, and clearly for your ocular health. They're of significant importance as well.
Mm-hmm. Mm-hmm.
The other thing I heard you say earlier that, again, that's one of those things that we talk about being important, but it's probably one of the things that's, kind of not really high up on people's thought processes in terms of eye health is drinking water.
Oh my
Drinking.
goodness. Hydration. Oh my. We need water. We need water. And when we talk about hydration, when I talk about hydration, I might have someone who's coming in with a dry eye, or someone who's wearing contact lenses. So with contact lenses, you need tears in your eyes for them to be comfortable. And a lot of times people will come in with, uncomfortable contact lenses, and their eyes feel dry. And when I'll ask them about, well, do you hydrate? Do you drink plenty of fluids? Oh yeah, I drink plenty of fluids. I drink 6 cups of coffee a day. I'm like, no, 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 no. I'm talking about water. No. What?
And just for the record, people, although there is water in coffee, coffee dehydrates. Okay. It is a diuretic and it dehydrates.
Dr. BryantBruce, I'm telling you, how many people have told me but I make my coffee with water. So I'm getting my water, and I have to keep a straight face, right? We can laugh right
Gotta
now,
be functional.
So having water, you need water, and once again, that's going to give you better tear chemistry, and once again, help with the health of the eye.
And for all of those out there who say, I don't like water, you can actually kill 2 birds with 1 stone here, because you heard him say water and you heard him say antioxidants. And if you put a little lemon juice or a little lime juice in that water, it gives the water flavor, and you have antioxidants, a high dose of vitamin C going into that water. So you've got 2 benefits there, and the water tastes better.
Mm-hmm. Beautiful. I'm going to try and tell people about that squeeze of lime, and because I do that, the squeeze of lemon, squeeze of lime, and
a little squeeze of orange juice, a little squeeze of pineapple. It doesn't matter what type of juice, but caveat being, use the real juice of the fruit. Don't get the little sugary juice cocktail mix and put that in your water. That's just adding sugar that your body doesn't need. But if you use real fruit juice, whether it's pineapple or orange or grapefruit, lemon, lime, whatever, you're adding those antioxidants that are so good for your body.
So I saw Hurricane H laughing about that coffee comment.
Hurricane, did we hit a nerve?
Yeah.
No, actually, no.
He knows somebody. He knows somebody who consumes a lot of coffee.
I know. I mean, I drink coffee, so don't get me wrong. I mean, I get at least 2 cups a day, but I definitely drink a lot more water. I mean, water that's the essential liquid of life. I mean, you can't go without it. And I think, unfortunately,
he says 2 cups a day, but what do those cups look like is my question.
I don't have one next to me, but they're pretty big. Well, actually, no, not the kind of one of those jugs that you get from a local store, like one of those gas stations. No, just small regular little cups, with some nice coffee. And that's about it. I just need my little fix.
To the office all the time, they say, "Oh, I only drink 2 cups of coffee, or I only drink 2 cans of beer." And it's like, dude, if you drink 2 cans of the tall beer, each of those cans has 24 ounces. That's 3 glasses of beer. So you drink 2 of them, you've had a 6-pack. That's a 6-pack. Okay.
What you know, we're talking about the coffee. You know, we're joking about it, but water. I
Yes.
mean, doctors. I mean, you know this. We've had the first show we had, you and I, Doctor, was about preventative medicine, right? And looking at
Mhm.
that, water is not just. I mean, your eyes ultimately, but your kidneys, everything. You know,
Mhm.
your
Everything.
skin. I mean,
Everything.
everything.
Mhm.
So if you're not drinking enough water, that's a problem across the board. Period. Your bowel movement, you name it, it's going to be a challenge.
Yeah.
And
And
so,
that's a really big deal for all of our midlifers. I mean, half of the population, more than half of the population are boomers and beyond. And so water is a big deal for them, as they're in the mirror checking for the wrinkles. Before you reach for the eye cream, the first thing you should be asking is, am I drinking enough water? And that water will significantly affect the aging process.
it's like plants, right? If you know, we're just same, right? It's normal. You put more water into it, not too much, the right amount, and it's green and it's nice. And if you leave them there without any water, they just dry up. So same thing with us. People don't put that analogy, but it's fact. you
That's
know,
perfect analogy. Perfect analogy. I like that one.
we are. I mean, you know, just similar, right? So I did have one thing, you know, about you mentioned about the cataract, piece. Can we expand on just what that looks like, you know, for audiences? Because, you know, I have seen actually the process personally, and it's pretty simple. I mean, it's 10-15 minutes, but you know, can you just guide us through that whole experience and what it means for people, doctor? I mean,
Absolutely. And so cataracts, let's say it's our human lens that becomes cloudy, and there's different types of cataracts. Um, Things that typically happen are that the vision decreases. People tend to say that, it seems like I just need more light to read and see things now. There's problems with glare, excessive glare.
Mm.
And some people actually see halos around lights at night, around street signals or headlights, or look up at the moon and they'll see a big old halo around the moon. So as the eye matures, the lens tends to get more dense and thick and cloudy. With current technology, totally different from previous technology. Before, they used to take just the entire lens out of the eye, and then people would either have really thick glasses. Eventually, they actually started using intraocular lens implants, which is a prescription lens that they put in place of the lens that's removed, the human lens. So it's an artificial lens. Um, Current technology, when they were taking the entire lens out, there's jelly in the eye. That's how the eye holds its shape. It's called vitreous humor. When they would remove the entire lens, the vitreous would come flying forward through your pupil, and it would take the retina with it. So everybody was getting retina detachments. So in the old days, they had to actually put people in a bed and lay them head on their back with sandbags on the side of their head so their head would move for a few weeks to try to stabilize the eye. They figured out that this wasn't working. So now what they do, I always give an analogy that a cataract is like a Ziploc bag with a bunch of cloudy stuff in it. And the state of the art procedures now are that you go in, the cataract surgeon will go in, make a little circle, cut a little circle on the front portion of that Ziploc bag, remove it. There's a special device called a phaco emulsifier. It uses high frequency sound waves. It shatters all the cloudy stuff inside that cataract, inside that Ziploc bag. It
Mhm.
shatters it, sucks it out. The back part of that Ziploc bag, known as the posterior capsule, stays in place. And that keeps the vitreous from flying forward.
Mhm.
They put the intraocular lens implant in now. Now the technology is absolutely phenomenal. And so before, the lens would only be just one prescription, and you could have the prescription for your distance vision, you could have it for your computer vision, or you could have it for your closed vision. Now they have technology that allows you to have all of the above, where you can see far, computer, and close with state of the art technology in intraocular lens implants. And cataract surgery before, it was one of those things where, you just delay it as long as you can. Now it's like, I tell patients, I said, especially the ones with the really high prescriptions, I tell them that, oh, I can't wait for you to get cataracts. Because yeah, and they look at me, I'm like, yeah. And so you'll have someone who was like incredibly nearsighted, okay? I mean, literally who couldn't see more than like maybe 12 inches in front of their face, where everything would be blurry after 12 inches. They'll get cataract surgery, and all of a sudden, literally within 30 minutes, they're seeing 20/20 with no glasses or contact lenses. And the responses that I have had in my office after someone's gotten cataract surgery have just been phenomenal. I have people sit in my chair and they're literally just get choked up and say, I haven't seen like this in my entire life. I've worn glasses as long as I can remember. And now I can see without any glasses. I just can't believe it. So
that has to be so rewarding for you.
It's quite rewarding. It really is. And once again, it's to share something with you. I've actually had cataract surgery also, and I developed cataracts early. I was incredibly nearsighted. And then once again, I went to a really good cataract surgeon in West LA. And I literally woke up the next morning, looked across the room. I could see the numbers on my little ADT security alarm pad. You know what I'm talking about, right?
Yeah.
I could see that from across the room. And it scared me to death. I'm like, something's wrong. Whoa. And then, I got used to it. So once again, I'm just a total fan of cataract surgery. Of course, you do have to have a good surgeon, someone who is definitely up to speed. All cataract surgeons are not created equal. Once again,
do your homework.
Pardon?
I said, do your homework, research your doctor.
Absolutely. You want to do your research. Absolutely. And once again, I think cataract surgery is absolutely fantastic. It used to be the criteria was if you couldn't see better than 20/40 on the visual acuity chart, then it was time. Now that criteria is totally different. The criteria is your vision, is it causing something in your daily life that you cannot do anymore, that you can't be comfortable with? And examples are like, I have a lot of golfers, and I'll have guys and ladies come in and say, I can't see my ball after 70 feet. I'm asking people in my group where my ball is. That's a good indication to get cataract surgery, okay? Artists, because cataracts can affect how you see colors. And so I'll have people that will tell me that, people were telling them, their clients were saying, your work is different. It doesn't look right. And it's because they can't see the colors. And so once again, the criteria has changed. If something's affecting your life, if, you're having problems driving at night, get your cataracts taken out. You'll be a happy camper.
Yeah, doctor, you mentioned something about when someone has nearsight or other problems, right? And they can do it. Now, can someone opt out without having a cataract problem, just having different problems, and just say, okay, I'd like to have the cataract to just get a better visual effect, overall early on, even if it's not too late?
That's a great question. And so there are some individuals who are young and they just have extremely high prescriptions, and they're contact lens wearers. All of a sudden they can't wear contact lenses because their eyes may be dry or they may have allergic response. And so for those individuals, there's a thing where they actually do what's called a refractive lens exchange. And that's basically doing cataract surgery without really having a cataract. And so that is an option. There's pros and cons to doing that, but that is available now. There are surgeons that are doing that successfully with young people who have, like I say, extremely high prescriptions, where it's actually, handicapping the person.
So Good.
For midlifers, pretty much right at 40, bam, the eyes start changing and we start to have some vision issues. And my father was recently telling me that there is a new treatment out there where you can actually use drops and it improves the vision and takes it basically back to normal. Can you expound on that? Because it was something that he saw in passing, and I was like, okay, well, I need to talk about this.
And so they have come out. It's a drop that was used a long time ago, primarily for the treatment of glaucoma. It's a derivative of what's called pilocarpine. And so it's a lower dosage of pilocarpine. And the reason that it allows individuals to see clearer close up is pilocarpine constricts your pupil. So it makes your pupils really tiny. And so by making your pupils really tiny, it actually gives you clarity. You think of it like you're subtracting blurry vision. There we go. So it basically has what's called a pinhole effect. And I'm not a fan of that, mainly because I don't know why anybody would want to walk around with their pupils constricted all day. And then there's all these warnings about that too, because once again, as you can imagine, if your pupil is really tiny, driving at nighttime could be a little bit of a challenge because your pupils are so small. When it gets dark, our pupils dilate so we can get more light in our eyes so we can see better. And so this drop does just the opposite. It's an idea, it's a concept. I'm not a proponent of it because once again of all the other side effects. But once again, it is a technology. They're always trying to find
some of the side effects of pilocarpine.
Pardon me?
I said, what are some of the side effects of using a pilocarpine type of drop?
Well, one of them that used to be one of the bad side effects used to be people who get these really bad headaches. That was a big one. And so that's how come when it was used for glaucoma, it was all that was really available back then in combination with some other drops. But pilocarpine was one of the main drops, but headaches, just bad headaches. And then once again, like I say, your pupils are small, so you're always struggling. You just you don't have enough light to see anything.
Right.
So, those are the main effects of pilocarpine. But yeah, I mean, that is available. It has come out not too long ago and it's there.
Now, another issue that people have that I wanted to talk about and whether there's anything that can be done with it, and I know it can be an issue with contacts, is astigmatism. Talk to us about astigmatism.
So astigmatism is the uneven shape of the front of the eye, the cornea. And so instead of being perfectly round or spherical, where the curves are equal in all directions, you have one curve that is different in shape than the other curve. And they're usually perpendicular to each other. So that's what astigmatism is. The word sounds so bad when you tell someone they have astigmatism. They're like, well, doc, how long do I have to live? No, it's not that bad. So astigmatism causes a distortion in your vision, and it can be corrected with either glasses or contact lenses. State-of-the-art technology and contact lenses, great for astigmatism. Before, there wasn't much available. It was strictly hard lenses to try to create a nice even surface on the cornea. Now there's soft lenses that do that. We are always concerned about astigmatism, though, especially with high amounts, because of a corneal degeneration called keratoconus. And this is something where the cornea, it just literally degenerates. It becomes very thin. It starts to bow out and form like a cone, literally like a cone. And now there are treatments for that to it's called corneal cross-linking, or it's like a rebar for the cornea to reinforce it. And it uses a riboflavin and ultraviolet light, and it reinforces the cornea. So before, there wasn't much we could do about keratoconus. The eye would just deteriorate, the vision would just diminish, and then at some point the eye would actually become painful because of the nerve fibers on the cornea being affected, and the ultimate result would be a cornea transplant. So now,
and just as a refresher, for those who may not remember, because this isn't their area, the cornea is the colored part of the eye there, and riboflavin is a vitamin. So
yes,
just so that you know
so
what that is.
The cornea actually covers the colored part of our eye. The colored part of our eye is the iris, and the cornea is that clear covering that goes over the iris. And so
It's the eye skin, right? It's the equivalent of the skin.
It's not a skin, it's a clear tissue. It's clear tissue. It's avascular. There's no blood supply. And it's literally just it's a window. It's just a window. It's the first part of the eye for which allows you to see. You have to go through that front window, and then you go through your pupil, then you go through your human lens, which is the other part, to make everything focus on the back of your eye, your retina. So with the cornea, once again, there was when you had someone who had keratoconus, it was just a matter of waiting until they needed a cornea transplant, trying to find a good donor. And it was pretty bad. But now technology is just amazing. So once again, we always like to check children for, it's important to have a child get his or her eyes checked to see if they do indeed have astigmatism. If it's a large amount of astigmatism, we're concerned, and we have to monitor that and see if there is, at what point do we need to initiate treatment. But it's just something that, once again, if you don't get it checked, you won't know about it.
Now, I might have missed something here, but you said that people used to have to wait a long time because they had to wait for a match for the corneal transplant. At this point in time, are they still having to worry about a match and rejection and that kind of stuff? Or is there some sort of artificial material that's being generated, that's being used for the corneal replacement?
Right now, it's human tissue. So there's actually donors. There's a pretty large bank of donor corneas. And so, once again, much better than before. So there is availability.
So for all of those of you who have filled out the little back of the card for your driver's license and have agreed to be organ donors, thank you for that, because you can save other people's vision, you can save other people's lives with the organs that you donate.
Doctor, I'm listening to you, both of you, and it all goes back to key element: prevention, early detection. It
is so much easier to prevent than it is to treat.
Agreed.
And this starts, to your point, Doctor, early on. I mean, you don't wait too long. I mean, I think from the moment that the baby is born, I mean, there's doctors that check their eyes and throughout the cycle, and as they grow, I mean, we all have to go through those things. But sometimes, coming from an insurance space, I think there's one problem that we encounter, especially in our healthcare system, is that the cost sometimes can be a problem, and people are always afraid to go to doctor, any type of doctor, because they think it's going to cost me money, or I can't afford the glasses. That's always going to be a challenge. But understanding that there are a lot of ways you can get through this stuff, and there are insurance programs, there are different, even discounts available and things like that. In your expertise as a specialist, are there any things that you can, I guess, recommend to people that are listening, watching, in the event that they may not have the ability, or they have fear of not, being able to afford some sort of procedure?
Well, for let's say, being out here in California, we have what's called CenCal. That's the Central Coast equivalent of Medi-Cal.
Okay.
And so Medi-Cal is definitely something that takes care of a lot of people. And so, and there are a lot of other clinics that actually do cater to low income. And so there's definitely availability. And but once again, the Medi-Cal or SenCal, that's huge. In other states, it's Medicaid,
Medicaid.
where
Mhm.
and Medicaid is for, once again, for low income, and there's access. There's definitely access.
And one of the things about Medicaid and Medi-Cal that people should know is, although it is to assist low income, there are a lot of programs within the Medicaid system. So you still may be able to afford it if you're not just on the poverty level, because people think, oh, in order for me to be on Medicaid, I have to be on poverty level. No, that is not the case. And yes, you can have a job and still have Medi-Cal or Medicaid. So, certainly if you're struggling with your finances, don't allow that to be a barrier to you getting help. Go ahead and go out and research it. You can, stop in on any of your social services offices and inquire about it. Nowadays, you can go online and you can find out about different types of insurances. There are insurance brokers online. And if you have some questions, Hurricane Elemonte is an absolute expert in the area of the insurance industry, and you can throw us a question. Don't be shy about sending questions. We want you to like this show. We want you to comment on this show, because your comments are the things that we'll answer. If you have questions, we're happy to answer them. So if you have questions about insurance, please definitely reach out to us if you don't know where to go.
I just go ahead, Doctor. No, please go, and then I'll just add something
on the insurance. There's also non-insurance entities that do provide healthcare and eye care. And up here we have the Lions Club. There are other organizations that they're just there. They especially for children. And all you have to do is just ask them, and they'll take care. They will pay for an eye exam and glasses for children. Once again, the Lions Club is one of them, and I'm sure that if you just research in your city and find these little organizations, they're there because they want to help.
Absolutely.
Go
ahead.
No, I was just going to add, so you covered a lot of them, but for seniors, that's also a question, because Medicare, unfortunately, does not cover your vision, and Medicare Advantage, does. So for those folks that might need glasses, a lot of plans out there really have good programs available across the nation where you can get the glasses, and sometimes the allowance is pretty good, so you can still get that. So again, just to cover the angle, you can get the services, and a lot of the services can be covered, one way or the other. So it's just a matter of asking. And Doctor, as you said, we can receive those questions, and we'll be more than happy to answer more details and guide you the right way.
Yes.
And to talk about
as Dr.
Medicare,
Richardson was, go ahead.
To talk about Medicare, one of the misconceptions of Medicare is that they don't cover an eye exam. Medicare, they actually do. It's considered medical. So once again, if a patient, and I mean, there's not many 60, 70, 80-year-olds who don't have cataracts or dry eye. So these are medical conditions. And so when our seniors with Medicare come in, I mean, they do get the full eye exam. They do get a refraction. The refraction is the part that determines what your eyeglass prescription is. Medicare does not pay for that little piece. A lot of times it comes out to be $35, and they'll pick up the rest. Medicare will take care of the rest of the bill. And also with the Medicare, they also have what were called the supplements. And some of these supplements have actual vision plan insurance. One of them is Vision Service Plan, another one's iMed, where they're actually linked to their Medicare. They're part of their benefits. So the Medicare will take care of the services, and then their other supplement, the vision insurance, will take care of the glasses. There might be a $10, $20 copay. So there's definitely things related to Medicare where, once again, we can keep our seniors seeing and keeping their vision healthy by all means.
Yes, absolutely. And then one of the questions that I have is, with all of the advances that we have on the eye front, both in optometry and in ophthalmology, are we seeing a decrease in blindness?
Yes, I would say absolutely. And once again, just if nothing else, just in age-related macular degeneration, we've seen decreases in blindness from that. And diabetic retinopathy, we're seeing decreases. But once again, that little caveat is, if the patient doesn't come in to be treated, we can't, get those numbers, keep those numbers down. So the technology is there. Yes, we are definitely preventing blindness. It's a whole, and the thing is, this is happening in short periods. 5 years in our profession now, it's fast. The changes that occur in just 5 years are just phenomenal. 5 years ago, some of these treatments seem like they're primitive. They seem like they were during the time of the caveman. And so things are moving really fast. And it's just constant research and development to, as you just said, save vision, stop people from going blind.
I want to go back, and I always like to bring it back home to nutrition. I mean, there are third world countries all over the world that are still suffering grave eye morbidity, and the reason for that comes down to poor diet, food deserts. Things of this, even within this country, we have food deserts, places in the inner cities, places that are low income that don't have good access to high quality food. And you see differences in the health disparities because of it. So, when we talk about prevention on all levels, but certainly prevention on the level of eye health, when we talk about antioxidants and such, again, it comes back to, let's get that good nutrition in there. Let's eat those fruits and veggies, eat from the rainbow, and get those omega-3s in there. And there are lots of ways to get omega-3s in, from the omega-3 rich fruits to nuts. Omega-3 rich fish, nuts, omega-3 rich fruits like avocados. So, there are lots of ways to get those in. For all those folks who say, oh, I don't like fish. Okay, I'm not going to eat the fish. There are other ways to get them in, but it is important to have that balanced, rich diet. It does help with prevention of, things that affect all aspects of the body and certainly affect the eyes. And one little interesting thing that I'll note is, I used to do a thing called the Do You See Me workshops, and they were a diversity workshop for people with disabilities, to help people understand what it was like to have a disability and to see people with disabilities as people with different abilities. And so one of the things that we would do is we would go in and we would, quote, disable them. And, they were assigned different disabilities. They might be assigned a physical disability, like, a leg might be tied up so that they couldn't use that leg and they had to use crutches or a cane or whatever. Some people, we plugged their hearing so that they became hearing impaired. And some people, we blindfolded them We made them visually impaired. And we actually did this in the schools, and it was with the approval of the parents. So we would do it for 3 days. So they were not only challenged in school, but they were also challenged at home. And it was an agreement with the parents that they would not remove whatever their disability was. So they actually had to go through 3 days of their life in the shoes of someone who had different challenges. And what was astounding to me was how, I don't know, I can't think of the word I want, how much trauma it caused the people who were blinded in comparison to the other disabilities, how much more challenged they were. And so your eye health is extremely important. So much of how we interact with our world and the information that we take in from our world is taken in through those peepers. So it's really important to keep them healthy. It's really important to go see your optometrist and get that regular checkup so that if anything is going on, early prevention.
So I wanted just to ask one more thing, which you mentioned it briefly, Doctor, was LASIK. For our audiences. I mean, I know we talked cataract and different other treatments, but what is LASIK, for our people, and how does that differ from like a cataract surgery? And is there an age limit to it, and that kind of thing? So,
great question. And so, the difference between LASIK and cataracts are two different areas of the eye are being operated on. With the cataract, that's behind the eye, that's behind the iris, behind the colored part of your eye. Mm-hmm. The LASIK is like Dr. BryantBruce was just talking about, the cornea. That's the front of the eye. And so what the cornea does, it bends light. And so if it doesn't bend the light properly, that's how we are either farsighted, nearsighted, or have astigmatism, or any combination of farsighted with astigmatism or nearsighted with astigmatism. So what is done is that the cornea, kind of picture the cornea being like an Oreo cookie, okay? So with LASIK, the top part of that Oreo cookie, there's a little circle that's cut with a laser. It's removed. So the top part of the Oreo cookie is folded back. The creamy filling is reshaped. And so it's reshaped into a prescription. And then the top part of that Oreo cookie gets put back down on top. And so within just a few seconds, literally, that's how fast the lasers are working now. It's literally within a few seconds. The cornea has been altered. And so once again, the creamy filling, the center part of the cornea has been altered, and a prescription has been created underneath the top part, underneath what's called the flap. Once again, this procedure takes literally just seconds to perform. And LASIK, there's just millions and millions of successful cases. I've worked with LASIK surgeons since 2004, actually. And I've wholeheartedly believed in LASIK because it works. A lot of times it was kind of sad in our profession at the time. Optometrists thought that LASIK was a fad. So Hurricane H, if you had come into an optometrist's office and they were asking you about LASIK in the 80s, they would quickly say, don't worry about it. It's like rap music. It's a fad. Right?
Yeah. How that worked out.
Whereas I knew that this was pretty much revolutionary, that people are going to want LASIK. The ability to not have to wear glasses or contact lenses. Oh my goodness. And so to answer your question about as far as the age range, you want to have an eye that's not changing. So for a lot of people, if you're nearsighted, you're going to get more nearsighted up until your mid to late 20s. So you need your prescription to be stable for at least 2 years without changes. At that point, LASIK is a good option. It does have its limitations. And so that's when you brought up that topic about people with high prescriptions who could they get cataract surgery without having cataracts. That's one of the situations where that would be relevant. So cataract from LASIK, I say it does have its limitations. Once again, it is something that stable eye, when you reach in your 40s, as Dr. BryantBruce was saying, how things change. Now you have to take in consideration the ability to see things clear close up.
Mm-hmm.
So a lot of times if you have someone who has LASIK when they're 30, they're going to probably get a good 10, 15 years of clear vision, both far and close. And then they'll start to probably need glasses just for seeing close up. Mm-hmm. As you get older, I wouldn't recommend LASIK because at some point you're going to get cataracts. So if you get LASIK, well, then it's not going to hold. It's not going to be clear because you're going to have cataracts. So you're going to have 2 procedures done that were, you only needed 1 done. So, but LASIK is just a great option for vision correction right now. Once again, the technology is absolutely phenomenal. The lasers that they have, fantastic. When they cut that little flap, remember I was telling you about the top part of the Oreo cookie? They used to use a little blade called a microkeratome, and they would have a blade and it would cut. Now they use lasers, and the laser is so precise that it cuts this flap. And then when the top of that cornea is put back down, it's like a manhole cover being put in the manhole. And so there's less complications, faster healing. Once again, it's pretty painless. People are up and functional the next day.
Now, a lot of surgeries are being done robotically these days. Are you also seeing that in the area of ophthalmology?
No.
Okay. So it's still hand done.
It's still done by hand. Once again, there's assistance from technology. Once again, assistance from lasers. That's the big one. That's really been revolutionary right now. So someone doesn't have to do things free-handed, but someone has to operate the technology, and that's where the high quality surgeon comes into play.
Okay. The question that I have is, let's talk a little bit about contact lenses, because there were hard contacts, there were soft contacts, but you had to take them out, and now there are actually contacts that you can sleep in. Can you tell us about those, and do you recommend them?
Yes, I can tell you. No, I do not recommend them. There we go. Moving right along. No,
straight up.
I asked about it because I went to a conference, and I did not realize that my partner wore glasses, and she says, "Oh no, I have the contacts that you can sleep in." And I thought to myself, I thought you really weren't supposed to sleep in contacts. So I'm like, it's a question when I have Dr. Richardson on the show. Talk to us about it.
So there are contact lenses there's contact lenses. They've been approved for overnight wear for years now. The concept is good, but the actuality, think about it. You're leaving this thing in your eye that has accumulated whatever is in the environment that day. So you're outside, you're getting dust, dirt, whatever bacteria are on your hands, or you shook hands and you rubbed your eye. So all this stuff is going to be on your contact lens. And so for you to go to sleep with that, it just doesn't sound good. And all of my literally nightmare cases have come from people who have slept in their contact lenses. Because what happens is, once you do get a microorganism in your eye, it gets trapped behind the lens. It doesn't have anywhere to go. And a lot of microorganisms, they love healthy cornea. The nutrients in cornea are just fantastic for microorganisms. And they will literally just eat a hole through your cornea. And that's what a corneal ulcer is. Very painful. And depending on where the bacteria have been eating through your cornea, it can lead to blindness, literally, or just like a huge scar where you're looking through a dirty window every day. So, as far as leaving lenses in, sometimes if you have a really high prescription and you've been out late one night and you don't have anything to put your contact lenses in, it's like, okay, you leave them in for a night, you'll be okay. But people that leave them in for weeks, I've even seen months, I'm just like, oh my goodness. And it's interesting how I've had healthcare providers leave their contact lenses in for a month, and I'll show them. The other thing is, remember I was telling you earlier that the cornea is a clear tissue and there's no blood vessels on it. Okay? It's a clear tissue called avascular tissue. Well, when you get this contact lens on there, now you have something that's covering your eye. Your cornea gets oxygen from the air. So when your eye is open, you're getting oxygen from the air, from the front, and you get some oxygen from the back of your eye. Once you cut this supply of oxygen off, well, the body's an incredible thing. So your cornea is dying it's not getting oxygen. So the body says, well, where can I get oxygen from? Well, there's oxygen in blood, right, Dr. BryantBruce?
Right,
so
right.
Now, what happens is the cornea starts to grow blood vessels to get oxygen to a tissue that is being starved of oxygen. These blood vessels start growing, and it can look pretty ugly. They're faulty blood vessels. They're not supposed to be there, so they have weak walls. They can actually start to leak blood onto your cornea and leave huge scars, and it just gets ugly.
It's a mess.
The good point about it is that when you get these blood vessels growing, known as neovascularization, once you remove the contact lens and let the cornea get oxygen, the blood vessels, they go away. There's going to be a little sheath, a little line where they were, but they'll go away. So, don't Hurricane H, tell all your friends that are sleeping in contact lenses, don't do it. Don't do it.
They're listening to the show right now.
Say no. Just say no.
Worldwide news.
No.
Don't do it.
Don't do
There
it.
you go. There you go. Okay.
Also,
now, I think this is going to be another don't do for you. But what about these people who are using contacts as a fashion statement and they're changing the colors of their eye by putting contacts in when they don't necessarily need contacts? What is your thought on that?
My thought on that is that if they're actually fit properly by a optometrist, do it. My problem is when you have people going to the swap meet and buying these colored contact lenses. I don't know if you're aware of that. You can actually buy contact lenses at a swap meet.
And that's a scary thought, because most of the swap meets into, for starters, they're not the most sanitary places, and anybody and everybody is selling whatever,
Thank you. And people are buying contact lenses at swap meets, and they're using them. And I mean, once again, the three of us are sitting here saying, why would you do that? And you'd be surprised how many people they do it. So
I imagine that some of those contacts are fake contacts, not necessarily even quality material.
Yeah, they're very cheap.
Yep. Yeah, some of them do come from different countries. Absolutely.
Actually, you can order online these things.
Okay.
Amazon.
Yes. Amazon's great. I'm not mad at Amazon. I love my Amazon too, but things that go in your body, that go on your tissues, that go in your mouth, and that go on your skin, I tell patients, leave those alone. Don't get them from Amazon, because you don't know where they're coming from. And in spite of the fact that they may say that they're brand, the knockoffs are really exceptionally good these days. So leave that alone. If your body can in some way consume it. And if you're putting something on your eyes, that's a direct portal for your body. So not Amazon, not the swap mate. Just say no.
Listen, to your point, I mean, there's an optometry almost everywhere. You can go and get your prescriptions, whatever, get a nice script. Make sure you test them out and you get them from a good source. That's it.
Yes. Yes.
Doctor, you mentioned something earlier, the word optometry, but then also you mentioned ophthalmology. So can we just clarify that for our folks? Because, which one is which? Because it sounds like it's doing the same thing, but just for our audiences, what would be the main differentiator?
Well, there's the three O's that people confuse are optician, optometrist, ophthalmologist. Okay. So your optician is the one who is going to actually fit your glasses, take the measurements. Optician can also grind the lenses. That's called a bench optician, where they actually fabricate your glasses. They make them. Optometrist, doctor of optometry. We have to go through a minimum of 4 years of optometry school. We can do internships and residencies in other special areas. We diagnose, treat disease. Okay, we do everything that's pretty much non-surgical. We can do minor surgery. So if you came into my office, you're a worker, you're doing some construction, you were banging a nail on some metal goes into your eye. You come into my office, I can remove that metal out of your eye. So things like that, they're called foreign bodies. We can do minor surgery. We can, let's say, take things out of your eyes. Once again, we do the exams for glasses, contact lenses, for vision therapy, people who have eyes that turn in or turn out. There's treatment for that. There's exercises for that. But we are fully trained to diagnose and treat disease. Glaucoma is one of them. In certain states now, we're actually able to use lasers to treat certain aspects of the eye. That number is growing. We have about 10 states now. We just had the bill in California, and the governor would not pass it. Boo, boo, and our governor. Boo.
Yeah, well.
I'm not supposed to get political. Okay.
No. You don't get the doctor started here, because we've had challenges before. So
our ophthalmologist is a doctor who actually goes to med school and then goes to study strictly the eye. And the ophthalmologist is the one who can actually do major surgeries such as cataract surgery, retinal repair for retina detachments and things like that. Certain types of surgery and I was talking about eyes that turn in or eyes that cross out. I say we can do exercises, whereas ophthalmologist can actually go in and alter the muscles to try to straighten the eyes out. So ophthalmology, mostly the main difference is that they can do surgery. And we don't do any major surgery. But as far as treating disease, diagnosing and treating disease, we have many similarities.
Thank you, then.
Okay. And then one of the things that you did talk about in minor surgery, and that one kind of, piqued my interest, because I do some work in occupational medicine area, and we get a lot of workers that get the little metal shards in their eyes. And I just wanted to say, if you're a worker and you have something fly into your eye, particularly if you feel like your eye is scratchy or, you feel something in the eye, please do go and see the optometrist. A lot of times it's what we call a corneal abrasion, where that little film that Dr. Richardson talked about has been nicked or scratched, and they are very, very painful. They heal very quickly. But sometimes, even though you say, oh, well, it might look like a speck, or I don't even see anything, if a little shard of metal has entered the eye, sometimes you cannot see it. Or sometimes it'll just look like a little fleck on your eye, but it'll actually be a shard, and it needs to be removed by an optometrist. If you don't go and get it done right away, it becomes a bigger problem because it can cause a rust ring in the eye, and that's a much more extensive thing to have to remedy. So, and if you've got one in your eye and it moves, it can cause damage to the interior of the eye. So if you have something that flies into your eye, don't blow it off. Go get it checked. It's your vision, and it's not worth losing your vision to save a few dollars.
And Dr. BryantBruce, going on what you preach, prevention. Wear safety glasses. Please.
Goggles.
Okay, wear your safety glasses, your safety goggles before you start banging on metal. Okay.
Exactly. And before you start banging on metal, before you start mowing the lawn or using the weed whacker, all of those things, wear your safety glasses. Don't be cool. It's okay to get some really cool safety glasses, but wear the safety glasses. And speaking of safety glasses, again, going back on the sunglasses thing, Dr. Richardson, am I correct that eyes do get sunburned too?
Oh, eyes can get sunburned. Those are situations where that's very painful. A lot of times we see sunburned eyes, like when you go snow skiing and you don't have any protection. You get these radiation burns, or sometimes from being around water, in the intensity of the sun reflecting off of the surface can really do some damage. Painful. Very painful. I mean, your eye, the cornea will regenerate and heal, but the process, it's not pleasant. So yes, once again,
prevention.
Prevention.
And sunglasses are cool. Sunglasses are way cool. So prevention. Prevention. Right. So Dr. Hurricane, do we have any more questions? I mean, I can think of 100 million, but any pressing, burning questions for Dr. Richardson tonight?
No, you covered a lot. How we reach here, people, that are in need of help in the area, can they reach you? The website or information, location that they can come to, or that kind of thing, because we want to put that on the description of the show so people can actually have access to you.
Yes. Well, my website is pismoeye.com. And I have an office email on that. I have a phone number. Any questions, please reach out. Anything I can do to assist, I'm more than happy.
Thank you. That's it for me.
I did get the website correct. So the website will be listed on with the show, so people will be able to reach you. And again, you can always reach any of our guests by reaching out to us. And then I'm going to do a little self-plug here right now, unabashedly. My partner, Commander Alex Wright, she and I are working on our midlife mastery program, and we have a workshop that will be coming out in January. It is current for January 23rd, and it is called Mojo Rising. So think about it, and we'll tell you more about it as time goes by, but Mojo Rising, you want to be there. So sounds good. Those of you who are navigating those midlife waters, come on and join us for that Mojo Rising. So, like I said, unabashed, unashamed plug for our program coming up January 23rd.
Actually, we'll put that too. It is important, so people need to know, and they can sign up. And hey, I think for the next few shows, we'll just make it as a standard announcement, as a trailer, until it happens.
And we'll drop little tidbits to give you a little bit more information as to what's coming down the pike with it. And just for the record, our website, Cheryl Bryant Bruce MD, has been revitalized and updated, and you can get loads of information. We'll have calendars and such. And so as events are coming up, those will be listed. As I have speaking engagements coming up, those will be listed, our classes. We do have an app coming up, Epic Performance app. And when the app is available, that will also be listed on the website. So, check back on our website often, and you'll be able to see what we have that has come out recently, and certainly check back on the network often, and you can see the shows that are coming up and the shows that have already been. And I would just like to remind everybody that these shows are not a one-shot deal. If you didn't hear the first part of the show and you thought it was really interested and you want to hear more of what Dr. Richardson or any of our other guests say, or you thought it was so interesting that you want to hear it again, these shows air 2 times each week. And even when the show is done airing in its cycle, we do have these shows evergreen on YouTube and Vimeo and lots of other places. And for those of you who do not have access, or you don't want to watch the show on a screen, you want to hear it while you're driving to work, we do have the podcast. This show will be showing up as a podcast, and the podcast also do the same thing twice a week. They're on the network, and then they are in places like Spotify. So this information is out there for you. Eat it like dinner.
You will find those shows. You will listen to them. You will watch them. There's no way you can miss them. Just everywhere that is podcast, radio kind of concept or visual, you'll have them. Social media, you'll have them. And you can also just go to the website, either one of the websites, the NBCTVnetwork.com or your ihealthradiousa.com, plus Dr. Cheryl's, website. So you'll have that available to you.
And Ashe to you, Hurricane. I mean, this man's amazing. He pretty much works round the clock on this network because we're not the only show on the network, and it's everywhere. He comes up with platforms that I've never even heard of. I was like, where do you even find that platform? But he finds them all. So this show is everywhere. We are worldwide. We are not just a national show. We are now a worldwide show. So
I was just looking at the stats, and all over. I mean, from Australia to Africa, Europe, Canada. I mean, you name it. And I can go deeper, but not for the purpose of the show. But I mean, everywhere, folks, you're listening, you're watching, you can get the real mojo, the real stuff, and you get the resources as well and the access. And this information is valuable. I mean, this is like so much learning today, just for me personally. I mean, we've picked up a lot.
Yeah. And one thing about the show, like I said, the idea is to educate, inform, and entertain. But I think that Hurricane and I actually have we have more fun with this show than anybody else. I mean, we're having fun sharing it with you, but goodness, the education that we get every week, because we have to be here every week. So the education that we get every week, by the time this show goes off the air, which we hope will be never, we'll be some of the smartest people around. So we definitely are having a good time doing this show. And we love you, our guests that come and share the information with us, and we love you, our audience that comes and consumes this information. We hope that it's providing you great value and will help you to optimize your health. So, Dr. Richardson, Thank you so much for joining us. And like I said, this is my bestie, so it's always good to see a friend. And
Thank you
we'll
so much
definitely.
for having me, you and Hurricane Ace. This has been a wonderful, wonderful, like you said, fun time. And once again, thank you so much. I'm glad I could contribute. And once again, I'll be looking forward to seeing more great things from the two of you. Okay. So I hope everyone has a great evening. And once again, I wish you much success. Okay.
Thank you, sir.
Okay. Good night.
Now, everyone.